Hi, everyone. My name is Isha Singha, and I'm the Senior Policy Analyst here at the Association of Asian Pacific Community Health Organizations. At APSHO, we're committed to providing you technical assistance, program, and research support, and as well as keep you up to date on policy and advocacy initiatives, and that's why we're here today. On behalf of APSHO, I wanted to thank you for joining us today for the webinar entitled, What the Health Center Funding Cliff Means to You. We're excited to present you with information on how the Health Center funding cliff impacts you and your health center, and on what you can do to ensure that community health center funding remains intact. Before we get started, I wanted to review a few housekeeping items and let you know how you can participate in today's webinar. Here we're looking at an example of the GoToWebinar attendee interface, which is made up of two parts. The viewer window, shown here on the right, but maybe on the left on your screen, depending on your browser or computer operating system, allows you to see everything the presenter will share on her screen. The control panel, shown here on the left, but it might be on the right on your screen, allows you to participate in the webinar. By clicking the orange arrow button to the right of the control panel, you can hide or show your control panel. You can also set the control panel to auto-hide or not to auto-hide by going to the View menu. Please note that all attendees are in listen-only mode and will be muted during Amanda's presentation. To participate, you can click the blue Raise Hand button shown here on your control panel. Alternatively, you may also submit questions in writing during the presentation by typing them in the questions field. We'll be reviewing questions as they come in, and we'll address them during the Q&A session, which will be held after Amanda's presentation. Today's webinar is being recorded, and you will receive an email with the link to view a recording of today's presentation after the webinar. As I mentioned earlier, we're excited to present you with today's webinar on how the Health Center funding cliff impacts you and your health center, and on what steps you can take to ensure that that funding remains intact. As many of you may already know, community health centers are facing a threat unlike any other in health center program history. The looming health center funding cliff presents a potential 70% reduction in health center program funding, which is scheduled to take effect in 2016. In the coming months, health centers will also have to make sure that programs essential to health centers' sustainability, like Medicaid, remain intact. We're hoping that the information shared in this webinar will be helpful to you in communicating the urgency of action to prevent the health center funding cliff, which ensures that community health center funding continues to be able to support the more than 22 million patients that health centers serve. Joining us as your presenter today is Amanda Pierce-Kelly, who is the Director of National Advocacy and Civic Engagement at the National Association of Community Health Centers, NAC. Amanda leads the development, coordination, and management of NAC's federal, state, and local advocacy campaigns, and she provides technical assistance and consultation to state primary care associations and health centers on policy issues and strategy. Additionally, Amanda spent her first 2 years on staff with NAC, working concurrently as the Associate Director of State Affairs, helping to analyze state, federal, and regulatory policy initiatives and crafting model legislation to assist state primary care associations with localized legislative and public policy issues. Having joined NAC in 2005, Amanda has spent much of the past 9 years traveling extensively throughout the country to provide policy and advocacy trainings, as well as technical assistance and strategic planning to state affiliates, partner organizations, and the more than 1,200 health centers nationally. We're really excited to have Amanda here today. And with that, I'll hand it over to you, Amanda.
Thank you so much. I always get I blush when I hear my bio. Really, from my perspective, I work for you guys, everybody on the line, and I'm really, really pleased to be able to chat with everybody today and walk through some of the just the basics on what we're dealing with in Washington, what our funding stream actually looks like, what the cliff actually looks like, and then what we're doing to make sure that Congress and the President act very quickly, we hope, to make sure that the cliff is corrected and that the program funding can stay intact and that really everyone can continue doing the incredible and excellent work that you are on the ground. So we can head on to the next slide if you like. Again, you can go to the next one. I think it's helpful to just sort of start with what are we dealing with in Washington, and to be honest with you, the slide that we're on now and the slide that you'll see next, it hasn't changed much. The glass half empty when it comes to Washington and Congress is the same thing that everybody sees on the TV and in the news and all those talking heads, and that is that there's a lot of partisanship in Washington. There's a lot of polarization and folks that are not so good at working together, who many of whom want to stick to a party line and are not really open to having conversations about compromise. There are issues and laws that are divisive, meaning that any discussion about it will cause people to sort of go to the extreme. And unfortunately, the Affordable Care Act is one of those issues that really causes a lot of division in Congress, but I think around the country. And we just came through an election that tells us that that's still very much our reality. The other thing is that because of the environment we are in, there's a lot of attention being paid to how the federal government is spending money, where that money is going, whether or not it is being effectively spent, and the quality of the programs that are receiving those dollars. And in an effort to make sure that we are spending wisely and hopefully reducing our spending, quite frankly, Congress has imposed many different things, such as budget caps and looking at ways to curb spending in the future. So singly, each of these things might be not easy to deal with, but manageable. All of these things together make Washington a very difficult place to get things done. It's a very difficult place at times to get people to be open to considering new directions or how they might compromise. But, and we can go to the next slide. The glass half full is that health centers as a program and individually have this incredible history of bipartisan support. We have just as many Republican champions today and in our history as we do Democrat champions. The reason for that is because our model is very sound. We have the data and the numbers to back up the incredible work that we do, and we've also always been driven and based in our mission, which speaks really to everybody, no matter what side of the aisle they happen to come from. That's the first thing. The second thing is that no matter who's in power, part of the environment also demands that it's not enough to just talk about how this isn't working or that isn't working or we need to overturn this or repeal that. There also has to be some proposed solution for how we change the scenario and how we improve. You know, it's very easy to point fingers and talk about what needs to change, but without any proposal for how we should change it or what happens next, it's not very effective. And so, again, I think no matter who is in the majority in Washington, the expectation is very much that they need to have a plan for how they will change things. And the great piece is that because we enjoy this wonderful bipartisan support and both sides of the aisle recognize the effectiveness of the program, the quality of the program, and the cost savings behind the care that we provide, we are often one of the very, very few programs and opportunities out there that Congress can agree on. And we are often at the center of the conversation when it comes to where do we go in the future. So you can hit the next slide if you like. So switching gears for a second so we can tie this all together. It's really important when we talk about the health center funding cliff to understand that the health center program has a couple of different funding streams. And many of you have probably seen this and heard this many times. But what I would ask you to do in looking at this slide and you know, as part of the conversation today is think about how you can share this with your colleagues. Think about how you can make sure that everybody in your circle, both at the health center directly, but probably in your community as well, understands how health centers are funded and why this health center funding cliff is going to affect far, far more than just the health center program. It will have a ripple effect that goes across the entire community. And part of helping to connect those dots is helping people to understand how it actually exists when we talk about the health center funding cliff. So the first and probably the most important piece is to understand our funding stream. We have our discretionary funding on the left-hand side there. This is the annual appropriations process. So every single year we have to go to Congress and make sure that they approve funding just for the health center program. So hopefully many of you are familiar with our health center funding Dear Colleague letters. They run, typically they're circulated in Congress in March. And that's just for our annual appropriations on the discretionary side. And right now the health center program is funded at $1.5 billion. That was in fiscal year 14. Believe it or not, we're actually still trying to hash out the final stages of fiscal year 15 funding. We're operating on what's called a continuing resolution, and it's still to be determined what will happen with the next fiscal year of funding. But that's a process that we go through every single year, and that's the discretionary side. The other funding stream is called our mandatory funding. Mandatory funding currently, it came as a result of the Affordable Care Act in what was called the Health Center Trust Fund. It was specifically for the purpose of building and expanding the program. And when Congress put this together and they funded health centers through this trust fund, which was to the tune of $11 billion, just as a reminder to folks, they mapped it out over a 5-year period with anticipation of the fact that with the passage of the Affordable Care Act, there would be a huge flow of people coming into coverage, and they would need a place to go to access their care. And so the thought behind it was, well, what better place for these people that are newly covered to access care than health centers? But in order to do that effectively, they knew they were going to have to invest in our program and make sure that we expanded our capacity to be able to treat these folks. So for a 5-year period, they mapped out the investment of that $11 billion trust fund. And actually, in fiscal year 2015, it's the largest investment from among that 5-year roadmap for expansion for the program. But it's really important to understand that the mandatory dollars are very different than the annual appropriations. And when we talk about the health center funding cliff, the largest portion of what's lost is on the mandatory side. So you can go to the next slide. So here's a really important bar graph, and again, I'm hoping that a lot of you guys on the line or looking at these slides have seen this before, but again, I would just encourage you to think about getting this in front of your colleagues, your board members, and the community at large so that they can actually see with their own eyes what this means when we talk about the health center funding cliff. So to start, the light blue bars there across the bottom, and you can see in fiscal year 2010, it's actually the tallest light blue section. That's our discretionary funding. We took a hit in fiscal year 2011. Some of you might remember it. It was a $600 million loss to our discretionary funding. But the reality is health centers never really felt that. And the reason is that was the first year that we started receiving the mandatory dollars as part of the Health Center Trust Fund. So what Congress did, or at least the way it translated on the ground, is that despite the fact that we took a hit, that $600 million loss on the discretionary side, they were able to backfill with the mandatory dollars so that unfortunately we didn't see the intended expansion that year, but we never truly experienced a cut to our bottom line at the health center level. Now if you keep going year to year, getting us all the way to fiscal year 2015, which, as I said, is still being determined, you can see that the top part of the bar, the darker blue, which is the mandatory funding, which is coming through, again, the Health Center Trust Fund as part of the Affordable Care Act. It's ramping up because, again, the intention was there's going to be so many people coming into coverage, which has worked out a little differently than we may have thought starting in 2011. But nevertheless, the investment continues all the way through fiscal year 2015, and then suddenly you see in fiscal year 2016 it disappears because that's the end of the Health Center Trust Fund under the Affordable Care Act. Now, making this more complicated is the fact that we did sustain that loss in discretionary funding back in 2011, fiscal year 2011. So not only are we losing all the mandatory dollars, which is essentially to the tune of $3.6 billion, we also need to make up for the loss we sustained back in 2011, and that's just to keep the program whole. So I just want to pause and kind of go through these bullets quickly. It is about a 60 to 70% reduction in health center grant funding for every single health center. I get that question a lot. The other thing is that it's not just the health center program that's going to experience this kind of funding cliff. Unfortunately, as many of you hopefully are already aware, programs like the National Health Service Corps and the Teaching Health Centers program are facing the same issue. The primary difference with those two programs is that they don't have any discretionary funding to back them up. So they will literally be zeroed out and cease to exist. That's the National Health Service Corps and the Teaching Health Center program, which I don't have to tell you guys are critical programs to support the health center program. So not only are we really in a potentially catastrophic situation with our own funding cliff, two really key programs in supporting health centers are in jeopardy of losing all of their funding. So you can go on to the next slide. So a few things to bear in mind, and these bullets are here intentionally because I and many of my colleagues receive this question a lot. Is the health center funding cliff really real? You know, is it actually going to happen? The answer is yes. This is law. If Congress doesn't do something to change the law, this will happen as of October next year. So the clock is ticking at this point. The estimated impact, another question I get a lot is, well, is this going to affect every single health center? Is it just health centers that have been funded since, you know, the ACA was passed? You know, really, how hard is it going to affect everybody? A 70% reduction in grant funding will affect every health center differently, but every health center should anticipate some loss, and it probably will be to the tune of 70%. There's really no way of knowing how HRSA will determine the way to distribute that kind of reduction, but the easiest way to explain this and the best way for you to understand what it could mean to you locally on the ground at your health center is that it could mean a 70% reduction in your grant funding. And I think, again, I would just encourage everybody on the line to think about how you can have that conversation with the folks at your health center, your colleagues, your board, your leadership, your community partners, because they really need to understand how that translates. Does that mean closing doors? Does it mean less access to care? Does it mean staff layoffs? And then the ripple effect that occurs throughout the entire community from there. So in order to make sure that we put a stop to this, that the funding cliff doesn't actually happen, we really have to do everything we can in the context of advocacy to make sure we're turning up the volume so Congress and the President understand there literally is no other option than to get this fixed. And there are a bunch of resources we'll go through later, but we'll get to that. Next slide. So what we did was we launched the Access is the Answer campaign, and this is a logo that hopefully many of you have seen and are familiar with, but just so you are, if you haven't, this is what Access is the Answer looks like. You can go to the next slide. Again, this is our campaign to organize every health center advocate and all of our community partners and really everyone that cares about health centers to advocate to make sure that Congress and the President act to fix the health center funding cliff. And I think if you want a basic goal of what we're trying to do with this campaign, it's to demonstrate the support in the local communities for health centers sufficient so that Congress and the President have no other option but to take some action to get this corrected. You can go on to the next slide, please. So we launched the Access is the Answer campaign last February, actually. And since we launched, we have had a couple of different phases. We're currently in what we call the second phase of the Access is the Answer campaign. And with each phase, what we've done is we've established a set of action steps that every health center can take on the ground locally to demonstrate this outpouring of support to make sure there's action to fix the cliff. So as part of phase 2, and this is something that everyone on the line can be doing immediately when we finish this webinar. You can go and talk to your colleagues about these action steps and make a plan about how you're going to fulfill these things on the ground. The 3 current action steps as part of phase 2 is the first one, collecting local support letters. We've actually set a goal of 5 local support letters from local elected officials and 10 local support letters from community partners and stakeholders. The local support letters, just to be clear, are, for example, if you reached out to your city councilor, what you would be asking them to do is to submit a letter of support for the health center to your member of Congress, outlining the important role that the health center plays in the community, how devastating the health center funding cliff would be for the health center and the community at large, and asking them to take swift action to make sure that there's a correction to the cliff. So, and the same thing would be true when you're talking to a community stakeholder and a partner. You're asking them to send a letter of support on behalf of the health center to your member of Congress, asking them to take action to fix the cliff. The reason that this is important is that there's a couple different pieces to this. These letters allow an opportunity or provide an opportunity for you at the health center level to do some basic education with these individuals about the important role that you play in the community and all the incredible services that you provide to your patients in the community at large. It's an opportunity to educate them about the funding cliff, what it would mean at the health center locally, but also what it would mean to the community at large. And I can tell you, it translates differently at every single health center, but something like needing to close a site or reducing the number of hours that you're open or laying off staff is a very big deal to the community at large. And telling them that story is very important in terms of how we convey and advocate to our members of Congress the importance of taking action to get this corrected. The other really important factor with these letters is that your members of Congress are probably not used to hearing from these other voices in the community about the importance of supporting health centers. And that sends a very, very important message. If they're hearing from a mayor about an issue having to do with health centers and not to do with the mayor's day-to-day work, for example, or more funding for the mayor's office, that member of Congress is going to pay closer attention. They're going to perk up and say, boy, you know, we're getting a lot of letters from some not so usual suspects about this issue of the health center funding cliff. We really need to take this seriously and do something about it. So the local support letters are very, very important. And again, the goals are 5 letters from local elected officials and 10 from community partners. We set that as a goal for every single health center, but I will be honest with you, this is really meant to be an ongoing effort. And if you haven't started already, I would encourage you to make a list of folks you think you can collect these letters from, but keep working on it. Once you get to 5, set a new goal. Once you get to 10, set a new goal. That's the first action step. The second is to get some kind of local media placed between now and the end of the year. We have template letters to the editor and template opinion editorials and actually a template press release. And it's designed so that you can tailor it to your health center and your community. But the purpose really is to educate the community at large and certainly our elected officials about, again, the important role the health center plays in the community, but almost more importantly, what's at stake when it comes to the health center funding cliff. So again, we're looking for every single health center to place one piece of local media between now and the end of the year. We saw some really, really great coverage during National Health Center Week and just coming out of National Health Center Week related to the celebration of the incredible work that health centers do and all that they bring to their communities and their patients, and how devastating it would be if Congress failed to act to fix the cliff. And this is really a continuation of that effort. As it relates to members of Congress specifically, but I would say really all elected officials, they pay a lot of attention to local media. They are constantly looking at what issues are rising to the top in terms of priority in local communities. And so local media placement is a really great way to get these issues on their radar and get them to pay attention. The last piece, and I would say for anyone who has a new member of Congress, the last action step is setting up in-person meetings with your members of Congress. And for those of you with a brand new member who just won the election heading to Washington in January, it is absolutely critical that you set up time to meet with them in person at your health center sometime between now and the end of the year when they head to Washington. What we want to do with these meetings is make sure that they, again, understand all of the incredible things that you're doing in your community, the services, the care, the quality. Educate them about the health center funding cliff, what's at stake for the health center and the community at large, and then get their commitment to act quickly to make sure that this is addressed. For those of you with brand new members of Congress heading to Washington, you have another job. You really need to do everything that you can to establish a strong, supportive relationship with these new members of Congress before they head to Washington, so that when they get there and they are bombarded with a huge list of issues to cover and evaluate and take care of, that health centers are at the top of the list in terms of their priorities and something that's near and dear to their heart. And the best way that you can do that is getting them to the health center so that they can see with their own eyes all the incredible work that you guys do. So again, these are the 3 action steps as part of Phase 2, Access is the Answer, that we're asking every single health center to take between now and the end of the year. In all likelihood, you'll see a new phase of Access is the Answer come out shortly after the first of the year, kind of getting people excited and reinvigorated to continue their advocacy to make sure that we're going to fix the cliff. It's a long battle that we've got ahead of us. As I said, the cliff will take effect under the current law in October of next year. So the clock is ticking, but it's definitely a marathon and not a sprint. You can go on to the next slide. So to help you guys with all of these various action steps and all of the continuing advocacy around getting the cliff fixed, we have created templates for our petition, our Access is the Answer Fix the Cliff petition, our local support letters, our local media placement, pretty much anything associated with taking any kind of action around Access is the Answer and fixing the cliff. We have tried to create supporting resources, be it translated materials and templates, flyers and note cards to help you get the word out on the ground locally and among your patients. For those of you that are active on social media, we've tried to create badges and images that can be used across those sites to help raise awareness and draw people in to sign up as advocates and become a part of the campaign. On the side of telling the story of what the cliff actually means to you on the ground locally, we have an incredible research team who created what we call the Cliff Estimator tool. And what that does is it allows you to plug in your health center numbers. You know, it looks at your grant dollars, your revenue, your patient numbers, and some other demographics. And what it does is it actually creates a tailored one-page graphic of what the cliff would look like at your health center. And for those of you that are successful in setting up meetings with your member of Congress between now and the end of the year, this is a really, really important tool that I would encourage you to use and bring the graphic along with you for that conversation so that they can see what it actually means to you locally on the ground. We have other graphics and data points. We have charts and graphs that illustrate the impacts of the cliff. We have talking points and frequently asked questions to help you guys feel more comfortable having these conversations. And we've also broken the information out state by state, and in some cases we can break it out even by congressional district or regionally. So if you have questions or you need additional resources, don't ever hesitate to be in touch with me or anybody else on the NAC staff to make that request. We're always happy to help. The addresses to access all of these resources are right there on the left-hand side. On the advocacy side, you'll find almost everything under saveourchcs.org. We have an entire tab dedicated to the Access is the Answer campaign, And we're constantly trying to update and refresh the resources on there. But again, if you have need for anything you don't see on that website, please let us know. If we don't have it, we're happy to work with our partners to try to get it for you. And then on the data points and the research, the graphics and so forth, that can be found on the NAC site. NAC.com/CLIF is sort of our hub for everything related to the CLIF. You can go on to the next page, please. So just a couple of last pieces here. I think to be an effective advocate, one of the things that you really have to commit to doing and make a habit is staying informed and committing to act when the call comes in, and to be a good advocate, understanding what's expected of you. And the best way to do that is by joining the Campaign for America's Health Centers, which again you can do at saveourchcs.org. That will plug you into weekly updates about the most important things coming out of Washington and how they will impact your health center. More importantly, it will plug you into our advocacy network, and you will receive calls to action. We really go out of our way to make sure that we do not request any kind of activity from our advocates unless it is really important and necessary. We're very sensitive to the number of emails people receive, and so we try really hard to make sure that when we're asking for a particular action, whether it's emailing a member of Congress or picking up the phone and calling that Hill office, that the timing is very important and that they really do need to hear from you and that you will have an impact. A couple of other things that I'll plug everybody into is we do host national teleforums where we try to get everybody access to the latest information around our advocacy strategy and sometimes what's going on with our policy agenda. You know, really anything that's going to have a big impact on the health center program, we try to get that out there and available to our network using those teleforums. And so by signing up, you have an opportunity to get plugged into those. And then, of course, it also gives you access to our Grassroots Action Center. And so we try to make it very, very easy, simple, and quick to be able to communicate with your members of Congress, particularly by email. So if you haven't had a chance to sign up, I would encourage you guys to do that. Again, it's www.saveourchcs.org. And you can sign up right there for the campaign, and that plugs you into all of these different elements to become an advocate. You can go on to the next slide. So what's the bottom line here? I would just say that at the end of the day, when you look at what we're up against with a 70% reduction in grant funding, in program funding, Congress doesn't want to hear from NAC staff or APCHO staff, and my boss would probably kill me for saying that, but we have an incredible team, very, very talented staff who have very, very good relationships with all of the important folks in Washington up on the Hill. But at the end of the day, they don't want to hear from those people. They want to hear from the folks back home. What's important to them? What's this really going to mean on the ground? And if they don't hear from folks on the ground, they don't have any reason to think that these issues are important. So when you read that line, the future of the program depends on the strength of our advocacy. It's never been more real. We've never faced a challenge like this in the history of the program. Even Dan Hawkins, my boss, who likes to talk an awful lot about the block grant crisis back in the 80s, I think, would say that this is bigger than that. The outcome of how Congress chooses to deal with the health center funding cliff will change the way that the health center program exists. And it's up to us how they do that. So telling that story on the ground is the most important and key factor to your health center advocacy at this time. I think remembering that to be effective, it really does require a commitment to act. It's not enough to just join an advocacy list or network. You have to be ready to respond when there's a call to action to send an email or make a phone call or educate your community. And I understand very clearly that not everybody is comfortable doing all of those things, but we will work with you to make sure that you have the support and the resources to feel comfortable taking action and like you have all the information needed to be effective with this. And the last thing I will say is that we have an incredible opportunity to make the case for health centers and move Congress to act. but it's going to require our entire advocacy network, everybody on this webinar, everyone back home in your communities, on the ground at the health center, and hundreds and thousands more in order to make this case effectively and be successful. So with that, I will stop and open it up for questions. And then I think, Isha, you might have a couple other things you wanted to add as well.
Yeah, thanks so much, Amanda. Thanks for this great presentation and for breaking down all of this really important information for us and discussing the Access is the Answer campaign. So before going into APCHA's details, we wanted to give all of you on the phone a chance to ask any questions that you may have. And if while you're thinking about those questions, I have an initial question for you, Amanda. So in the case for community health centers that don't have that relationship, I know you touched on this a little bit, but don't have relationships with their local and state representatives, how do you think folks should kind of go about that in terms of advocacy efforts? And also, among all of the things that you mentioned in the Access is the Answer campaign, what do you think folks should start on first?
Well, good questions. In terms of folks, and you're asking specifically how to approach building relationships with state and local elected officials?
Yes.
Okay, so the nice thing, I mean, it depends on where you are, but I think when it comes to state and local folks, the nice thing is that they ought to be more accessible to you. And I think I would suggest that folks approach getting to know those folks the same way they would their members of Congress. And the best way to do that, again, is to invite them to your health center. I think, again, it depends on the area that you're coming from, but a lot of times these individuals, your local and your state folks, are going to be really excited to be able to engage with the community in that way. Some of them might be getting a lot of requests, but you know, healthcare is an issue that is front and center, and many of them are looking at, you know, what exists in the community and how they can learn more about the services that are being provided to their constituents. And so one of the best ways to do a couple things, educate them about the role the health center plays in providing those services in the community, but also to develop a strong relationship with them, is to actually get them there in person. If you have a hard time getting them to the health center, one of the best things that you can do is look at their meeting schedule. Essentially, most of them will put out there publicly in some form, you know, if they're going to be at a town hall meeting, if they're going to be at a public event of some sort, and go to one of their events. Use it as an opportunity to shake their hand, introduce yourself, and ask if you can follow up. And again, and then you extend the opportunity or the invitation again to get them out to the health center. If that doesn't work, then there's always a way to get in front of them. You know, you can. I'm happy to work with folks on sort of a tailored approach and understand the environment that you're in specifically. But I think the first thing is to make the effort. I think a lot of people just haven't spent the time or made the request or attempted to get to know them. And you might be pleasantly surprised that they're very interested in getting to know you and your organization if the invitation's extended. On the Access is the Answer action steps, they're all important. I don't really want to diminish any of them. I think for anyone on the line who has a brand new incoming member of Congress, getting them to the health center needs to be priority number one. Cultivating that relationship with them, there is nothing more important right now before they head to Washington. For those of you who have returning members of Congress, I do still think it's important to try to get them out to the health center, but I would say the other two action steps, maybe with added emphasis on collecting the local support letters, should be your first priority. And the reason for that is Congress needs to understand and see that there is just an outpouring of support for the health center on the ground locally, and that the expectation that there is action taken to fix the cliff goes way beyond just the health center community, and that, you know, the chambers of commerce, the hospital, the city council, you know, the grocery store, I mean, literally all walks of life in your community are supportive of the health center and feel strongly enough about what's at stake relative to the funding cliff that they would send a letter to them to urge them to act. So I think you want to focus on all of them, but I would probably put them in that order depending on, again, whether or not somebody's got a new member of Congress arriving in Washington in January.
Thanks so much. That's really helpful. And I just would add, Amanda, to your answer to the first question that I posed, that building relationships with your local and state legislators just provides a good opportunity to talk about the unique needs of APCHO centers and really trying to improve education of your legislators. So, Amanda, I have another question for you, and you alluded to this in your answer that you just gave right now, but just for folks to keep in mind, are there key dates that everyone can keep in mind for the action items that you mentioned?
Yeah, so the 3 action items for phase 2 are really to be carried out between now and the end of the year. That being said, the collection of local support letters and our Fix the Cliff, Access is the Answer petition, which is actually, that was part of our original launch that started last year. Those 2 activities are really meant to be ongoing. You know, I think, again, until you have literally exhausted every single elected official at the local, state level and county, you know, depending on where you are, and all of your community partners, I would keep at that. I think there's nothing more effective in some ways than being able to sit down with a member of Congress and hand over a stack of 150 letters or 200 letters from various individuals in the community and elected officials and say, look, you know, we really want to talk to you about the funding cliff, and, you know, we want you to know that everyone in the community is behind this. It's not just us. Or maybe you invite, you know, the president of the chamber or your state representative to come and join you at that meeting to echo how critical it is that Congress act. So I think that those are activities that everybody should be focused on really for the duration until we get this cliff fixed. But certainly, you know, the timeline for the specific action steps right now we've established through the end of the year.
Great, thank you. And I have another question. With phase 3 of Access to the Answer coming up, what is that going to look like for community health centers? And when is that going to start, and how can we get involved?
Well, I appreciate the eagerness. And what I can tell you is that we probably won't give out too much information on phase 3 action steps until we get a little bit closer to the kickoff. I would expect the launch of the next phase to occur pretty quickly, you know, after the first of the year. I can tell you that it will mimic very much what you've seen in the first 2 phases, meaning that engaging the community at large will continue to be a centerpiece of our strategy and of our action steps. So whether it takes the form of continuing our efforts on the collection of local support letters or the petition, you know, if it's not one of those 2 things or both of those things, it will be a variation to that, in addition to a couple of other maybe newer items. I can tell you guys that one of the things I would like to see more of is a greater effort to engage our patients. You know, we are serving more than 22 million people, and they need to have a voice in this as well. And quite frankly, they are going to be most impacted by the cliff if we're not successful in getting Congress to fix it. And so from an advocacy perspective, they really need to be a more vocal part of and visible part of our advocacy. And so I think you can expect more of that in the year ahead. But I can't totally show my cards yet on that one. But I do appreciate the eagerness.
Thanks, Amanda. Are there any other last points that you wanted to bring up? We're not getting any other questions, unless anybody else has any questions.
No, only that I would just say thank you guys for hosting the webinar, and for those of you that are participating that you know, for today. You know, we need more people to learn about the cliff. We need more education among our own community in the health center world about what this actually means. It's really startling to me how many conferences and meetings and discussions I have with folks around the country where they just are not aware of the health center funding cliff. And there is so much at stake. We just have to do everything we can to shout from the rooftops what is at stake for everybody and try to mobilize to make sure that there's adequate advocacy around this, to make sure there's action. So I'm looking to everybody that's participating today to help us serve as that megaphone to get the word out at your health center in the community and make some commitment to these action steps, but more importantly to advocacy as a movement and a culture at your health center. So, please, as I said, don't hesitate to be in touch with me or anybody on my team so that we can help you one-on-one to develop a plan that'll work on the ground at your health center and in your community.
Great, Amanda, thank you so much. So for everyone still on the line, if we were unable to answer your questions today, or if you have any concerns, please don't hesitate to contact us at civic-engagement@apcho.org. You can also find more information on our website at www.apcho.org, and we have links to NACS Access is the Answer campaign on there. As Amanda stated, we're going to continue to raise the volume on the cliff and continue to give more information about what's happening in next steps. Finally, Amanda, thank you so much for helping us pull this webinar together and under such a short amount of time, and for joining us today.
Absolutely, happy to do it.
Thank you so much. Thank you all for participating today, and we hope to work together with you to fix the funding cliff in the upcoming months. Please keep a lookout for an email from APCHO, and that's going to include the materials from today's webinar as well as action steps that Amanda had mentioned during her presentation. Thanks all again, and have a great rest of your day.
Thanks, guys. Take care.
You too. Thank you.